Meet Dr. Calvin Koo. He is working on making education on type 2 diabetes more accessible to patients, adopting a culturally appropriate approach to diabetes-related risk management. Type 2 diabetes is one of the most pressing chronic health challenges in Canada, affecting millions of people across diverse communities. Despite its prevalence, significant gaps remain in patients' awareness of how to manage the disease effectively and reduce the risk of serious complications. When type 2 diabetes is not well managed, it can lead to heart disease, stroke, kidney failure, and other life-altering conditions, many of which are preventable with timely education and risk management. Dr. Calvin Koo, an endocrinologist at the Toronto General Hospital University Health Network, is working to close this gap. He argues that traditional one-size-fits-all approaches to diabetes education often fail to reflect the cultural, social, and linguistic realities of patients' lives. As he explains, type 2 diabetes is highly heterogeneous and influenced by multiple factors, including environmental, genetic, and biological ones. There is a clear need for better health services and more effective approaches to managing this condition in order to prevent complications. Yet traditional education models often fail to reflect the cultural and social realities of patients' lives. The conventional approach typically involves lengthy one-on-one sessions with a nurse or dietitian. Patients are expected to attend in person and receive standardized, didactic information about diet, exercise, and medication management. This format can be time-consuming and inaccessible. It also relies on educational materials that are often not culturally appropriate, and many participants feel the information does not reflect their lived experiences. To address this gap, Dr. Koo developed a new approach that draws on advertising and marketing expertise to capture attention in ways traditional health communication often does not. The intervention involves sending tailored letters directly to patients' homes. Each message is adapted to the recipient's cultural context, referencing holidays, shared histories, or culturally relevant events. Storytelling and short narratives are used to spark interest before introducing educational content. Educational information comes after the reader is already engaged, he explains. The model builds on a previously successful Alberta program that reduced cardiovascular-related hospitalizations by 36%. Dr. Koo adapted the approach for ethnically diverse communities in Ontario, working closely with patients to ensure cultural relevance. Through the HDRN Canada Pragmatic Trials training program, he is developing a pragmatic trial protocol to test this intervention in real-world settings using existing health data. By moving beyond one-size-fits-all education, Dr. Koo's work offers a scalable model to reduce disparities in diabetes care and prevent avoidable complications.